We started off with 200 beds. Today we are a 900 bed quaternary care center. People have never thought about 3D MRI scans, PET scans, neuroradiology interventions. Our robotic program is on, and we already have got 2 robots. Today there is no reason why a patient should go outside the state. I don't think there is a better place than Trivandrum at this moment for investment for any of these investors which you have mentioned.
Hello everyone. Welcome to another episode of Aspire Stories of Innovation, the Technopark podcast. Today we are going to talk about a different topic, healthcare evolution in Trivandrum, from legacy to global investment destination. Something related to medical field, investment, all these things will be coming up. So who is our guest? Today we have with us a very senior healthcare management professional with over 2 decades of experience leading large-scale quaternary care hospitals and medical center. He has expertise in strategy, operations and growth. So who is it going to be? Very delighted to welcome Mr. Jerry Phillips, CEO, KIMS Health Trivandrum. Welcome to the show, sir.
Hi, good evening.
Good to have you here. So before we dive into the questions, could you briefly complete the introduction which I gave in maybe your own words?
Well, I have been with KIMS Health for almost now 18 years. I had no real plans to come to Trivandrum. I was in Bangalore.
Okay.
But then my children were small, so I thought, my parents were in Kottayam, so I thought, why not come to Trivandrum when I got this opportunity. But then being with this institution, I never felt that I should leave this place because it was a great journey being with KIMS Health.
So let's talk about Trivandrum or Thiruvananthapuram. This city has a long legacy, right, on healthcare dating back to the Travancore era with institutions like the General Hospital and Trivandrum Medical College. From your perspective, how has this strong public health foundation enabled the city's transition into a modern multi-speciality and quaternary care hub?
In fact, Trivandrum has been really fortunate. You have some of these reputed institutions which you mentioned, Medical College, Sri Chitra,
Right.
RCC. They have been doing some real exceptional work for so many years now. When we started off 20 years before, we were actually fortunate to have some of the senior consultants joining us. That's how we started our journey. But now, all of our departments, all of our clinical specialties and subspecialties have quite a lot of, it's kind of a team which delivers and leads some of the exceptional care in our hospital. So being in Trivandrum, the advantage was that talents are available and there was lack of quality beds at that point of time. And we were able to take the institution grow at a faster pace. Today, we are really happy to say that, we have some of the best specialties and subspecialties that we have developed over a period of 24 years of time. Many of our well-wishers who are placed abroad and who have access to care outside our country also, they come back and say that, this hospital is at par or in many a times it's much better than the care which is seen in the outside world. So that is, we see that that's kind of a very good achievement that which we have had. And that really helps us, and we think about it, that how we can keep delivering better and better care for our guests.
Over the last 20 years, like you mentioned, what have been the most defining shifts in Trivandrum's healthcare infrastructure, particularly maybe in technology adoption, clinical depth and evolving patient expectations, right?
A lot of things have transformed over the last 20 years. If you look at it, almost 2 decades back, patients didn't mind so much waiting for a consultant for half an hour or 1 hour and so to meet their consultant of their choice. They didn't mind. They didn't even mind the kind of infrastructure. They just went to a hospital, they meet the doctor, get the treatment. Even though it takes a day's time for getting those treatments and the diagnostics done, they don't used to complain. But now if you look at it, how demanding our people are. None of us want to be in a queue. None of us want to keep waiting for a doctor. We all want things to happen as fast as possible.
Correct.
We do not want to have extended waiting times in outpatient departments.
Right.
So all that has made us think, how we can reduce the waiting appointment times, how can we reduce that, and how can we make sure that we are time sensitive to the patient requirements, which is one of the very important aspects now. The other part is on technology. If you look at it, 20 years before, people have never thought about 3D MRI scans, PET scans, neuroradiology interventions which is happening, and which is wherein you need not do an invasive procedure, you don't need not cut open, suppose it's for any of your procedures, you need not cut open your for various procedures you have invasive procedures.
Right.
So the advantage of this is that it will help you to it avoids scars, and it also helps in reducing the recovery time. So people have never thought about such developments happening, and the kind of diagnostic improvements which has happened in the medical industry has been fantastic. So these kind of technological adoptions, and we are completely in KIMS, we are completely paperless or a paper light organizations. If you remember 20 years before or 25 years before, there used to be files which has huge load of information, entire information of the patient was in the file. But now all of our patients walk in with only one small card.
Correct.
And that number gives them access to the entire treatment they have gone with our hospitals.
Correct.
And that has everything that's everything stored in the electronic medical record format.
So, several institutions have contributed to Trivandrum's rise as an advanced care destination. So, from your vantage point at KIMS Health, what key milestones both within KIMS and across the city best reflect this evolution?
See, I've been here for 18 years, and I can see that transition happening very evidently in the city. We started off with 200 beds. Today we are a 900 bed quaternary care center. So earlier, if you look at it, the key departments which people used to speak about was general medicine, general surgery, diabetes. Today, people talk about subspecialization.
Right.
Right, like in orthopedics itself, there are a lot of subspecialties which has developed, like spine, hand surgery, sports medicine,
Correct.
ortho-oncology. So like that, a lot of subspecialties have developed over the period of years. And if you look into GI surgery, general surgery, there has departments like hepatobiliary surgery has come in, wherein a lot of complex gastrosurgical procedures can be done, and which has excellent outcomes. So like this is the age of subspecialization, and subspecialties are developing at a very, very faster pace. So that is one of the transformation we see in the medical sciences. And not only that, now disease prediction is also becoming a reality. How much you are prone for acquiring what kind of diseases, what is your genetic predisposition, and that is where genomics and genetics is fast gaining scale. And in Trivandrum, we are the first hospital to start genomics.
Okay.
So that is one of the most advanced way of understanding, doing the genomic studies and all. So we have a very sophisticated genetic lab which we have established very recently.
So, Trivandrum has recently begun attracting large institutional healthcare investment, including KIMS Health's partnership with Blackstone. So, beyond capital infusion, how do such investments reshape the governance standards, scale, and the global perception of the city?
Actually, they influence in a big way. In fact, I would like to mention that there are a lot of misconception. People say that large private equity players are coming, taking over hospitals. They're going to increase the prices, and healthcare is going to be very expensive affair for the common man, which is not a fact. What they are trying to do is that they have invested money, and they have invested in organization which can sustain the growth and which can be scaled up. They are just not here for a small period of time and get out after some time. they all believe in building businesses in a long-term perspective. If you look at it, most of these private equity players, they do a very, very thorough study before investing into any of the institutions. Like in our case, we have been consistently showing good growth in all ways, not only the financial performances, but in terms of our outcomes, in case of our service delivery, in terms of compliance, we have scored very well in all these aspects. Because right from the day of inception at KIMS, our founding principle itself was to develop an institution which is focused on quality, safety, and ethical practices. And we have always been transparent in all our dealings. And that is one of the biggest advantages which our institution had. And that is also one of the reasons why we have been backed up by one of the most reputed private equity partners here. And they also bring in a lot of, they also help to strengthen many of our processes. That is one of the biggest advantage with them. And then they are very, very, they give a lot of importance on compliance matters, which we always have been there, especially in terms of legal, statutory, minimum wages. So all that, they put a lot of, importance to that. And in terms of growth, if you look at it, they do very deep study before getting into further investments, which is a good aspect. Because there would always be a wish list that we want to acquire some of the latest technology and all. But then that all comes with a cost, and it has to be viable for those investments. So how the PE companies help is that they have a very good process in place wherein they look into the feasibility of any big investments. They have a meticulous way of evaluating the investment, and they also monitor how that investment is maturing. So in all those ways, they really help in developing and also fostering the growth at a very much faster pace. That is the biggest advantage which we have seen.
Private equities have been really cautious about investing in Kerala historically, right? But in your view, what changed in the city and maybe in the ecosystem level as well that made Trivandrum investment ready for such global investors?
See, Kerala, for some few years before, the perception was that it is not a very business friendly state. That was some of the perception which was there earlier. Thanks to the proactive initiatives of the government, that concept has been really changing, and it is kind of creating an environment which is very suitable for business. A lot of transformation has happened in the recent past, which is making it a friendly pace or a business friendly state. And that is one of the real reasons why you see this kind of change happening. Today you have got, in terms of talent, you have got the finest talents available here. Infrastructure is getting geared up. The recent developments and the growth is a testimony to the fact. You will see the seaport, the airport getting restructured. It's completely getting transformed. The number of flights are getting increasing. The road infrastructure, the technological development, the IT park expanding at a very faster pace, the life science park. This is all setting the right environment for growth in Kerala. And Trivandrum is fast changing, and that's what we all see in our day-to-day lives.
Kerala as such is seeing a surge in healthcare players, right? Many backed by private equities and institutional capital. In your view, is this a boon that improves access and outcomes, or does it have its own risk associated?
See, I don't foresee any risk because there is always a need for quality beds. So these kind of investments are very, very essential. One of the reasons being there is a demand for quality care. Today, people are able to afford, and they look forward to getting the best. The tendency of people to go abroad or go out of the state for high quality quaternary care is now coming down.
Yeah, right.
The reason being the hospital here itself are geared up to give the best care, the most sophisticated care, the most updated care for the patient at large. And Trivandrum, KIMS Trivandrum is a classic example. Today, there is no reason why a patient should go outside the state or outside the country for any of their healthcare requirements. Because our institution, if you look at it, has got all specialties and subspecialties.
Correct.
And we have continuously made sure that we are most updated in giving the best clinical outcomes. And that is how the genetics lab, which I was mentioning, the structural heart disease program that we have started, these are all, the high-end, the topmost care which any developed countries or any of the hospitals in developed countries can give you. The diagnostic facilities, the lab facilities, everything is state of the art and of the moment. Of the moment technology is something which we have always invested in. So this is going to ensure that patients get nothing less than the best. And good amount of affordable people and insurance coming in a big way. All that is going to strengthen the healthcare infrastructure in a very, very big way.
So, with the new large-scale facilities coming up, such as 550-bed hospital, how do you view the growing competition in Trivandrum? Does it accelerate the quality, specialization, and patient-centric innovation?
Yeah, usually people think that you have to be really worried about the competition. But at KIMS Health, we have never worried about competition. One is that we always plan ahead. Like we foresee down the years, after 5 years, what is the technology or what is the advancement which is going to come in.
Okay.
And as such, the EMR adoption, some of the technological advances that we have made in the institution is a testimony to the fact. And as I was mentioning, there is always a demand for quality care beds.
Yep.
Affordability is increasing. And the fast pace in which Trivandrum is growing, there is never going to be a competition for any good private hospital to come in. And competition will ensure better quality of care for the patients at large. And institutions themselves will grow when the competition improves, because you will have to really be smarter.
Yep.
And you will have to gear up your people, your infrastructure, your systems in such a way so that you can beat the competition. So that way, the entire healthcare ecosystem itself transforms and people have access to high quality healthcare.
So, again, coming back to Trivandrum, Trivandrum's strength has always been in its medical colleges, schools, research institutions, and IT backbone, again, through Technopark, right? So, how critical are these strengths when we talk about sustaining a world-class healthcare ecosystem?
See, sustaining a world-class ecosystem, you need to have, few aspects. One is talent. The other part is technology. Third is infrastructure.
Right.
And there is actually no shortage of talents, especially in Kerala and in Trivandrum. There's a lot of reverse train happening, where many of the senior consultants who have exposed to outside world want to come back and settle in Kerala.
Right.
So talent is not going to be a challenge. You have got medical colleges, you have got all the institutions here, Sri Chitra, RCC, and people wanting to coming back and settle down in Kerala. So talent is not going to be a challenge. Technology part, lot of advances are happening in our place.
Yeah.
Technopark companies, startups, and the government support to all this institution has been phenomenal.
Yep.
And if you see going forward, AI and robotics and AI generated tools, apps, these are all going to change the way care can be delivered to our people.
Right.
And medical devices is another part. So we see that we are in a right environment which actually is going to accelerate the way care is going to be delivered to our patients. Infrastructure part, definitely government is playing its role.
Yep.
And on the private institutions, the private hospitals, we have support from the private equity partners who are very, very clear that they do not want to cut any corners. They want to make sure that the best of infrastructure is being created for the institutions which they are associated with. And patients want, they actually want the patients to have the best of experience when they are approaching us for any of the services.
Right.
So infrastructure is definitely going to be strengthened and going to be very, very conducive and creating healing atmosphere for our guests.
So, looking ahead, how do you see capacity expansion, specialty growth, and technology adoption shaping the healthcare system in Trivandrum and Kerala? And where does KIMS Health see itself in this aspect?
We started off with 200 beds. We are at 900 beds now. And still there is a big demand for rooms. We used to get a lot of recommendations for getting rooms many a times.
Yep.
Because the public has really accepted our institution very well.
Yep.
And we have been really fortunate, and we really work hard on thinking how best we can improve the quality of care, how we can strengthen our specialties, how we can strengthen technology in giving nothing less than the best to our guests. And that is always something which we always work on, and that is something which we strive for. Going forward, we have an aggressive plan of expanding another 200 more beds in our campus. We have an aggressive plan for developing a hospital block which focuses on children. So KIMS Health Hospital for Children pediatric care is in the pipeline. And in a period of 18 months or so, we are trying to develop that project and create all the verticals for pediatric care in one block.
Okay.
And we are also looking into our robotic program is on, and we already have got 2 robots. We have got a TKR robot for knee replacements. For rehabilitation, we have got robots. And now we are for soft tissue surgeries and all. We are getting another robot in a month's time. So robotic surgical program is something which we want to really strengthen, and it's already started.
Okay.
And we also look into genetics lab I mentioned.
Yep.
Because genomics and genetic lab is something which we are really strengthening. Oncology, we have been doing exceptional care, and if you see the number of cancer cases are really on a very sharp trend, basically because of our lifestyle and our food habits, eating habits and all. Cancer is on the rise, so that's a disease burden is going to be on the rise. So oncology is one area which we are investing in a big way, because we want to offer the best possible treatment for cancer care in the state. So these are some of the developments which we are really actively pursuing, and we want to assure our people of Trivandrum that we will make sure that they have no reason to go outside Trivandrum for any of their healthcare needs, and we want to give nothing less than the best, and the best world-class facility is something which we have always decided for them, and that's what we are trying to give them.
So, if you were speaking to a global healthcare or life science investor today, what would you say makes Trivandrum or Thiruvananthapuram uniquely positioned as a city that combines the quality of life, clinical excellence, talent availability, and long-term investment stability?
The best testimony is my life. 18 years I have spent here, and now I don't want to leave Trivandrum. That itself is a testimony to the fact that Trivandrum is the right place. But then if you look at it, Trivandrum is in a very sharp growth curve.
Right.
With the developments which is happening here, the technological developments, the techno park, the research, and a lot of the life sciences park, airport, the changes, the modifications, the number of flights which are going to come in, the airport development which is happening, and most importantly, the seaport. With all these developments, I don't think there is a better place than Trivandrum at this moment for investment for any of these investors which you have mentioned. Definitely, they look for sustainability, and they look for diversification. Both these opportunities are there in Trivandrum. So without any doubt, I can say that Trivandrum would be the right place for them to invest.
So thank you, Jerry. It has been a great conversation today. We learnt about private equity, the investments, healthcare, modern, lot of healthcare phrases which are very new. But again, understanding that Trivandrum is getting ready, even though it is a fast-paced life, we are getting ready for anything and everything which is happening in the healthcare world, right? So very happy to hear from you. Thanks a lot for joining us.
Thank you. I think it was a great opportunity talking to you, talking to being here in Technopark, and I take this opportunity to thank each and every member of the Technopark family, and we look forward to strengthen the association, and we assure you that we will keep trying to give the finest care for you and all your family members. So that is an assurance, and we strive for giving the best. Thank you so much for this wonderful time.
With that, we have come to the end of this particular episode. Until we meet next time, this is Karthika signing off.